Right, so good day everyone. So for the class, we will be having an introductory topic with regards to self-care and medication. So basically class, we will be talking about why is it important that as pharmacists, we understand how we do self-care, okay? And of course, how do we advise our patients? Or why is self-care also important to our patients? Diba? Parang self-love lang yan. Napaka-importante sa bawat isa sa atin. Okay? So, what is self-care? By definition, class, it is the single act of preventing, diagnosing, and treating one's own illness without seeking professional advice. So that's pretty much self-care. Let's say, for example, meron kang acne. So what do? You usually apply beauty products, okay, to address your acne, right? Or halimbawa, nasugatan ka. What do we do? How do you take care of your wound? Normally, class, you'd be putting band-aids or di kaya betadine, di ba? Okay, to wash it without the need for a professional to put the band-aid on your wound. Right? So it also involves self-care, also involves diet, use of vitamins, herbal medications, lifestyle modification, and OTC medicines, which also includes class health and beauty care products. Okay? So that's still part of still technically classified as OTC medicines, yung mga health and beauty care products natin. So this is usually done to manage mild and acute conditions. Now, I'd like to highlight class these terms, right? It should be mild and acute. Okay, these two conditions. Why class? Because as long as a condition is mild and acute, ibig sabihin, pamadali ang sakit lang siya, right? It's more manageable. Okay, as compared class to something that's chronic, pag chronic na yan class, like say for example, your back pain has been there for so long na. Okay, baka may underlying cause na yun that should be addressed by a healthcare professional. Right? So what are different types of self-care? So we have two types. We have preventive and then the sickness self-care. When we say preventive class, ito yung ginagawa natin to prevent a certain person from having a disease. Let's say for example, a good example of this class would be nag-boom yung vitamin C during the start of the pandemic. Okay, for what reason? Ginagamit natin yung vitamin C as a means to boost our immune system, okay, to prevent you from getting COVID. Right? So preventive self-care class is a way of maintaining your well-being and appearance through the use of vitamins, exercise, diet, skincare products, etc. Okay? So class, halimbawa, you don't want to get pimples. So what do? You apply sa skincare products in your face. Okay? So that's still part of self-care. And then next one class would be sickness self-care, which involves diagnosing wherein a patient diagnose their own condition and obtaining products, okay, to mitigate their conditions. Now, we put quotations here, class, because we have to be specific. What type of product should a patient use for sickness self-care? Okay, obviously, class, patients cannot use Rx products, or what we call the prescription drugs. Okay, because this will require the assessment first of a healthcare professional, specifically your doctors, our doctors. Now, people rely on own knowledge. In self-care class, people tend to rely on their own knowledge and experience in making decisions. Okay, so the main concern of health professionals is that, are our patients making informed and appropriate decisions? Okay, kasi class, self-care is good. Okay, it gives a person control over their conditions. At the same time, class, it empowers the patient to do their own thing. I mean, to manage their own condition. Now, of course, class, it becomes bothersome when the information being utilized by our patients is something that is not legitimate, okay, or is not valid. See, for example, class, COVID-19 again. Let's not go too far. All right, COVID-19 class. During the time of COVID-19, ivermectin was a resounding medicine. Sabi raw nila, it's a very good drug used for COVID. Okay, it could help address COVID daw. As we all know, class, ivermectin is an antihelmintic medication. Okay, and it's not usually used for human consumption anymore, not that much anyway. Okay, and class, take note, COVID is a virus. All right, it's not a helminth, it's not a worm. Okay, so stuff like that, class. So that's why it's important that it becomes an issue, class. Okay, when you self-medicate and you're using wrong information to manage your condition. Now, this is of course where us pharmacists can play a vital role, because as pharmacists, we also carry OTC preparations in our pharmacies. And whenever our patient class, say for example, tries to would like to use a certain product, okay, for their condition, we can give advice, right? So that our patients will get the correct information or make informed decisions. So the survey po, last 2003, so sorry class, my datas here are very old, okay? So I hope you don't mind, pero pretty much all of these data are still applicable up to this day. Okay, 66% of consumers believe that the wide selection of health and beauty care products made decision-making difficult. 40% of participants ask help from pharmacists. Okay, because of the so many available OTC products we have in the market class, sometimes it's so difficult to decide which one to use. Say, for example, class, vitamin C. We have so many vitamin C products out in the market. Meron tayong ascorbic acid, meron pa tayong sodium ascorbate. Ano bang pinagkaiba ng isa sa isa? Right? The only difference, class, take note, is the other one contains the salt form, which is sodium. Right? The ascorbic acid contains sodium, which makes it more water soluble, hence faster absorption. Pero in terms of efficacy, class, there's no difference between sodium ascorbate and ascorbic acid in improving your immune system, in making you more resistant to having viral diseases. Right? So yun lang naman ang difference nun eh. And plus class, so since sodium ascorbate is faster absorbed, okay, so it makes it better in a sense. Pero does that justify the price? Only the consumers can decide for themselves. Okay? Whether they're okay with it or not. Okay? Or di kaya class, paracetamol na lang, right? When you use paracetamol, class, we have so many brands out in the market. Okay? If a patient wants to use Biogesic, not Tempra, okay, it's up to them. Right? Pero again, as pharmacists, it's our job to make sure that we give the right information to our patient. You just simply say, ma'am, they're just the same. They use the same active constituent. Okay? Probably the manufacturing process may be difficult, may be different. Okay? Pero they're pretty much the same medication. Right? Now, it's up to the patient if they want to still buy their branded products or not. So what's the disadvantage and advantage class of self-care? Okay? One of the major disadvantage of self-care is obviously the decision is biased. Okay? Pwedeng nanggaling sa kapitbahay, kamag-anak, yung information mo, which is not validated. Okay? Halimbawa, paggamit ng clindamycin para sa pimples. Clindamycin capsules. Right? Just so you know, class, capsules were not designed to be put on the skin. Okay? Not unless, class, you have a clindamycin preparation which is prepared for topical use. Then that's applicable. Okay? Pero yun, tapos ilalagay pa sa eskinol. Diba? Information depends on internet and commercials with poor data quality. So, that's one of the major disadvantage class of self-care. Because patients might not be using, what do you call this, validated or data of good quality. Okay? Di ba class parang Dunning-Kruger effect lang? The less you know, the more confident you become. And the more you know, the less confident you become. Okay? When it comes to giving information. Kaya oftentimes class, you'll notice people who are in the academe, okay, hindi lagi absolute yung binibigay nilang answers. Because they know class the dangers of saying that this will absolutely happen if you take this medicine or not. Because class, people in the academe tend, not all, I'm not saying all, but most people in the academe class tend to know a lot about the subject that they're talking about. Hence class, maingat sila sa mga sinasabi nila. Kasi alam nila na pag nagkamali sila ng sabi, malaki ang magiging repercussions nito. Or pwedeng mapahamak yung mga nakikinig sa kanila. Okay? Similar to me, class, when I was still new in teaching, napaka-confident ng mga sinasabi ko, ganito kasi mangyayari. If you take this medicine, you'll experience this and that and that. Only to find out, class, that the chances of you getting this kinds of side effects is very low. Parang Redman syndrome lang. Okay, probably 1 in 100,000 people experience that. Right? Pero, yun naman das natin itanong sa na anong side effect ang common sa vancomycin. Okay? So, stuff like that. Alright? Anyways, what about the advantage class of self-care? So, it helps empower patients. And the most important thing here, class, is it is cost-saving. Why? If a patient, class, say, for example, sinipon, okay, mukha namang viral ang sipon, kailangan niya pa bang magpatingin sa isang doktor para makabili ng gamot? Okay? So, it's going to be expensive because you have to pay for the doctor's PF. Alright? On top of the cough and cold preparation that you will be buying. Okay? There are instances, class, wherein a simple cough and cold can be managed in a pharmacy setting. Okay? Plus the fact, class, that whenever someone is of ill health, the first thing they do, class, is consult with a pharmacist. Or sige, fine, unahin mo nila kapitbahay nila, kamag-anak. Pero afterwards, class, they tend to buy their medicines sa pharmacy. So pharmacist, class, are in a situation wherein we are actually the most accessible healthcare professional in the community. Okay, tayong pinaka-accessible. Why? Because yun na nga, most of the time, when patients feel ill, they always tend to go to the pharmacy to buy medicines. So it's an opportunity for us pharmacist, class, to give information to our patient para matugunan ang ating sinumpaang pangako para sa taong bayan. Okay, na tayo ay tutulong sa kanila upang mapabuti ang kanilang mga sitwasyon. Alright? Okay. And not only that, class, okay, para makatipid din naman sila kasi hindi naman biro, class, ang presyo rin ng ating mga gamot. Okay? So, yun. So, what is our role as a pharmacist? Our role, class, is to assist patients in making informed choices. This is very important. Okay? We want them to be able to make informed choices. So, pharmacist has the expertise and training to screen patient health. Screening lang tayo, class. I'm not saying we diagnose. Okay? We do not diagnose. We do not do diagnosis. Something, class, that I want you guys to remember all the time. Okay, we have to respect yung ang limitations ng ating profession. Okay? Kasi, class, sasabihin natin lagi, okay, parang sasabihin natin sa mga doctors don't dispense medicines. Hindi niyo po linya yan. Okay, sasagutin naman tayo mga doctors, kayo nga mga pharmacists, nagda-diagnose kayo eh. Okay, so again, class, we don't diagnose, we simply screen our patients. Okay? Whenever we see red flags, class, are things that would merit immediate medical attention, then we recommend our patient to visit his or her doctor. Okay, so we screen our patients and apply this knowledge to select products according to the individual healthcare needs of our patient. If a patient needs medicines for their allergies, then oftentimes, class, we can recommend a lot of preparations for allergies. Okay? Madali naman makita yung allergies, nangangate, nagluluha. Okay? Or minsan, alam naman ng patient na may allergy siya eh. Okay? So we can always recommend products. Gusto niyo po ba drowse or non-drowse? Okay? Mga OTC preparations. Or preparations for allergies. Okay? So, treatment of common health problems, class, with medicines especially designed and labeled for use without medical supervision and approved as safe and effective for such use are often termed as OTC preparations. So, desire people to take responsibility for their own health and to reduce health expenditure is often one of the major driving reasons why people self-medicate. Okay? Because they want to reduce healthcare costs. Kasi nga, sabi ko nga, mahal magkasakit. So, we empower our patients to self-medicate. But again, class, they always say, a lot of doctors would say, it's wrong to self-medicate. Not all the time naman. Okay, there are conditions, class, wherein we can self-medicate. And as pharmacist, class, it's our job to catch, okay, what conditions can be self-medicated and what conditions should not be self-medicated. Say, for example, class, a patient comes into your pharmacy saying na ang anak niya may lagnat, 40 degrees Celsius, 5 araw nang nilalagnat. Sasabihin po bang, sige po, bili po kayo paracetamol, ito po paracetamol. Okay? Those are red flags, class. 40 degrees Celsius, that's already a red flag. 5 days na ang fever, hindi nawawala, that's another major red flag. Dalhin na yung pasyente sa ospital. Okay, lalo na kung bata pa, red flag din yun. Right? Oftentimes, class, when you're in a pharmacy setting, okay, especially in a community pharmacy setting, most often than not, class, the advice that you'll make for OTC preparations are designed for children. Okay, a lot of parents will be coming to the pharmacy asking the pharmacist, ano po ang magandang gamot sa ganito, sa ganyan. Okay, ito po kasi nararamdaman ng aking anak. Nagtatae po siya, nilalagnat, ganyan-ganyan. Pag ako nakarinig ng bata nagtatae, tatanungin ko, yan, syempre, gano'ng katagal na ho? Kaninang umaga lang? O sige, pwede pa, mag-ORS muna po kayo. Wag niyong bibigyan ng loperamide, lalo na kung yan ay 2 years old and younger. Okay? Delikado ang loperamide for pediatric patients. Okay, just give them ORS. Alright? Kung may nakaing masama, alright, kaya nagtatae ang bata, halimbawa, nakainom ng panis na gatas, okay, pwede naman tayo mag-recommend ng Ursiflora. Okay? Kung kayang ma-afford ng patient. Medyo expensive din kasi yung Ursiflora. Right? So, stuff like that. So, these are the things, class, that you'll be, why am I saying it now? Okay? Because you'll be learning these things, class, as we go on throughout the course. Okay? So, lagi nga tinatanong lagi ko tinatanong sa mga estudyante ko, ano sa tingin nyo kasi mas mahirap i-dispense? RX drugs or OTC products? Most students would tell me RX drugs, sir, kasi yun yung mga kailangan i-regulate. Okay, pero for me personally, class, as a pharmacist, pinakamahirap i-dispense for me are OTC products. For one main reason. Okay, kasi ako yung nagde-decide for that. Okay, kumbaga, I give the information to my patients and my patients would often use the information I give to them. So, pag may nangyari sa patient, okay, ako yung, konsensya ko yun. Okay, bilang isang pharmacist. Right, pero that's why, class, if I see red flags sa mga patients ko, oftentimes I would always say, visit your doctor as soon as you can. Okay? Now, why do people self-medicate? So, simply because there's restricted access to healthcare professionals, the high cost of health, and the increase in the size of the aging population. Okay? So, self-medication is not just used for acute illness. People are also doing for chronic illnesses. So, halimbawa, there are people, class, who take low-dose aspirin. When we say low-dose aspirin, this one is usually 80 milligrams. In the Philippines, sa US, class, that's 81 milligrams. Yun yung classified nila as low-dose aspirin. But for us, it's 80 milligrams. We do this to prevent MI, myocardial infarction. Okay? My aunt actually takes aspirin as an OTC preparation. Okay? It wasn't prescribed to her by her physician. But she takes it to prevent MI. My mother naman, on the other hand, uses clopidogrel because she has other comorbidities that could make her at risk for having another MI. She had an MI way back in 2006 pa. Right? Or other people, class, may take fish oil, okay, as a means to manage dyslipidemia. Okay? Or glucosamine with chondroitin for people with osteoarthritis. So, class, OTC preparation is not only designed for acute illnesses. It can also be useful for chronic illnesses. Okay? Pero, again, class, the OTC preparation that we use here are oftentimes supplements. Okay? We use this as supplements. Alright? Now, the NCPIE, or the National Council on Patient Information Education, did a survey in 2002 and found out that 59% of people in the survey said that they have used at least one OTC medication in the last 6 months. And approximately 20% of the participants believe that they are consuming more OTC products compared to 5 years ago. Because, well, one, class, more people are getting information, okay, with regards to the use of medicines because of the internet. Okay? Siyempre, tapos, word of mouth. Okay? And of course, class, nowadays, mas marami nang may access sa mga OTC preparations natin. Okay? So, here are some survey comparisons. Okay, we're in back in 2002 and 2001. Alright? You'll notice, class, that one of the highest selling excuse me, OTC preparation will always be analgesics. Up until now, class, okay, isa pa sa pinaka-fast moving medicine sa mga butika natin ay analgesics. Okay, and most of them, okay, most people daw tend to buy OTC preparations for pain, 78%. Okay, then cough and colds is the next one. So hence, class, napakababenta ng analgesics. Now, of course, proper use of analgesics would be helpful, but improper use of these medicines can lead to harmful effects. Let's say, for example, we all know, class, that most of analgesics are COX inhibitors, which could damage kidneys. Okay, of course, damaged kidneys could cause an elevation in blood pressure, right? Ibuprofen, class, is one of the most identified drug to cause an elevation in blood pressure, right? And so on and so forth. So improper use of certain medicines, class, can definitely cause some problems. Okay? So a survey by Roper Starch Worldwide, okay, states that consumers are confident with their OTC use, thinking that it is safe to use. 73% would rather try and treat their own condition than go to a physician. Okay, that's the reality of things. Sabihin man natin lagi kayong magpatingin, always consult your doctor. Okay, but the reality is, class, most people would still try to treat their own conditions first before consulting a physician. So, if that's the case, then we should address, kumbaga, yan ang problema eh. So, ano pwede natin gawin? Right? So, of course, class, as pharmacists, we can help by giving our patients the right information. Okay, more than 80% of the participants stated that they were satisfied with the non-prescription medications they used to treat their most recent health problems. Isa sa mga common nowadays class is insomnia. Kaya mabenta ngayon ng mga melatonin products. ZQL, okay, mga ganon. What else? Other melatonin products are very useful, okay, for people who are having hard time sleeping. Okay. Now, what are options for self-medication? So, obviously, class, we have OTC meds. Okay, then we have the nutritional dietary supplements, which includes vitamins, minerals, and then class, we have the natural products and homeopathic remedy. So, for OTC medicines, these are drugs known to have low toxicity, low risk for serious adverse reactions, and its main goal one of its uses should be, it shouldn't be masking any underlying conditions. Okay, OTC medicines should provide a correct self-assessment of the conditions. Or so, sorry, the patients should be able to identify correctly their conditions, okay, or do a proper assessment of their conditions. And the risk to public health is limited in case of misuse. Right? So drugs are usually approved as prescription only first, and just after they prove safety in clinical use, then they are recategorized as OTC. So meaning class, all new medicines will start off as Rx drug. There are no medicines that start off as OTC. They always start as Rx drugs. Now, after a few years of studying the medicine, okay, after phase 4 clinical trials have finished, okay, after a few years pa, then if based on the findings there is no serious adverse effect when misused, when the drug product is misused, then it is moved to OTC. Okay, so one of the things guys that you'll notice, this is a US data. Okay, one of the highest grossing OTC preparation class are cough and cold related products. Okay, that's one of the highest grossing. Well, number 1, mahal naman talaga yung products na to. Number 2, maraming gumagamit ito. But there's another reason for this one class. Number 3, okay, some people are actually abusing these OTC preparations. Specifically class, dextromethorphan, DXM. Because DXM class is actually derived from opioids, which makes DXM a highly addicting product. Okay, so that becomes a major problem, right? Okay, because of its addicting properties, okay, nami-misuse ang product na ito. Okay, so yun. And that's true class, it happens, okay, it really does happen. Now, in the survey in 2001, these are the common health problems, okay, that participants had in the last 6 months. Right? Actually, mas marami, may mga Philippine data na tayo pero hindi pa kasi published, so I can't get an access to it. Pero we have students class who've done research regarding these topics. Okay? So, number 1 would still be muscle back joint pain. Okay, lalo na ngayon, wherein most people are working at home. Nakaupo lang sa silya. So, ako hindi pa nakikita yung silya ko. Just like me. I'm starting to experience some back pains na rin. So, dapat proper ergonomics talaga lagi. Okay, followed by similar to cough and cold, flu or sore throat preparations. Okay, sorry, conditions. Headache, heartburn, indigestion. So, these are the most common health problems that most people experience back in 2001, which I believe still is being experienced by most patients nowadays. Now, what are dietary supplements? So, any product intended to supplement the diet and contain one or more of the following. It could be vitamins, minerals, herb, or amino acids. One thing you always have to tell class or patient is that dietary supplements are not cure. Okay, they do not cure. Okay, they are simply supplements to help aid, okay, the patient's needs. Kaya klase yung mga herbal preparations, sasabi lang for cancer, sagot ito para sa mga kidney problems mo, hindi siya talaga sagot. Okay, these are just supplements, diba? MX3 is a supplement, it's not a cure. Okay, stuff like that. So, A survey in 1999 to 2000, pinanganak na ba kayo nito? Baka hindi pa. Okay, 52% of consumers have taken a dietary supplement in the previous month. So, most common supplements daw used were multivitamins and minerals, right? Centrum. I think I have one here. Na-advertise talaga, no? Okay. So, multivitamins. Vitamin E, very good for the skin. Okay, also improves sperm count and sperm motility. Okay, kaya kadalasan yung mga hindi mabuntis, yung mga asawa nila, pinapainom ng vitamin E. Okay? So, vitamin C, very good for, of course, prevention of viral diseases. And calcium is a supplement commonly used by aging women, okay, for their osteoporosis. So, high demand created a dietary supplement industry with the yearly sales in 2013 totaling to $18.8 billion. Okay, so that's how lucrative, class, the supplement industry is. Okay, kasi biruin mo, class, halimbawa, sa Philippines na lang, right? Lagi naman magkakatalo yan sa marketing, how you market your product. Okay, if you have good marketing, class, then you create a demand for certain products. And you have a demand, okay, then there are, of course, buyers. Okay? So, yun. Kaya, malaking business ang supplement business. Right? Of course, pero minsan kasi ang mangyayari is, so dito, nami-mismarket na siya. Diba? Parang sa Usana before. Okay, Usana is a good, they are good supplements. Pero nangyari na lang sila sa networking. Okay? Tapos naisip ko yung na-scam siya. Ay, naging bad publicity pa yun for Usana. Anyway, next one. So, complementary alternative medicines. I think you had a lecture about this in your undergrad. Okay, and homeopathic remedies. So, many consumers seek the help of complementary alternative medicines due to high cost of medications and restricted access to healthcare professionals. Okay? So, between 36 to 74% of respondents use some form of complementary alternative medicines. Okay, back in 2008. And the most common form of complementary alternative medicines would be, number one talaga, prayers, class. Okay? Our belief. Okay, diba? Our belief, class, makes us believe in the impossible. Alright? Then followed by natural and vitamin products, deep breathing, chiropractic care, and yoga. Okay? So those are just examples. Now, when it comes to herbal preparation, class, herbal preparations are really good. Okay? As long as they are studied properly. Okay? Parang sa Pilipinas, class, we, as an Asian country, believe in the efficacy of herbal preparations. Pero syempre, kailangan, when you make a claim, it should be supported with scientific data. A very good example of this, class, would be, of course, lagundi. Okay, di ba lagundi, class, is known to be used for coughing, upper respiratory tract infections. Okay, so the University of the Philippines made a study, did clinical trials for lagundi, okay, and found out that yes, true enough, they do have those properties, and na-identify din, class, yung toxic concentrations ng lagundi. Okay? So, stuff like that. So, yun yung mga inaaral natin, class, dito sa Pilipinas. Pero at least now, when we say Vitex Negundo, okay, pag gagamitin nyo ng isang tao for their cough, at least we know, class, that it is effective. It will be effective because napag-aralan siya. Ngayon lang naman lagi ang hinihingi ng mga doctors eh. Okay, when it comes to the medicines, napag-aralan ba yan? Anong clinical trials niya na ginawa sa kanya? Okay, and so on and so forth. Okay? So, top-selling herbal medicines in 2005, number 1 si garlic. Okay, pero this is US data. Okay, echinacea. Okay, so palmetto, ginkgo biloba, and St. John's wort. Okay, garlic, just so you know, class, they have antiplatelet properties. Anticoagulant properties pala. And not only that, class, ginagamit siya for toothache drops because of the eugenol content. Okay, usually ginagawa ng iba, garlic, dinudurog, tapos nilalagay sa butas ng ngipin pag masakit. Okay, it creates a, what do you call this? Local anesthetic effect. Okay? Yan. Pero if you are using anticoagulants and you're taking garlic supplements, mag-ingat kayo. It could enhance its, enhance anticoagulant effect. Okay? So, for ginkgo biloba, class, just so you know, it has over 20 drug interactions, and St. John's wort have over 59 drug interactions. Okay, pero if I'm not mistaken, parang wala namang ganitong mga products sa market natin. I'm just not sure. Okay, so 51% of most patients fail to inform their healthcare providers about their herbal medicines. Alright? Kaya class, if you know someone who's pag na-hospital halimbawa, nanay, tatay nyo, if they're using herbal preparations class, then it's important that you share this to your healthcare professional. Or pag nagpapacheck up sila. Now, again, what influences self-medication? Number one would always be the cost of therapy. Followed by the aging population. Okay, sila yung pinaka-susceptible sa advertisements. Okay, sila yung naniniwala sa efficacy ng mga herbal. Okay, pero class herbal preparations are really good. Okay, provided that they were studied. Okay, and then gender differences. So in terms of the aging population, okay, we all know naman sa cost of therapy, right? Mas mura talaga pag OTC ka because you don't have to pay for the PF of your doctor. Okay, for the aging population, so they consume more OTC than any other age group. Okay, in a study, most elderly use an average of 3.4 OTC medications, which includes dietary supplements. That's number one. Okay, GI products, pain relievers, and then herbal products. Now, there are, of course, some safety concerns detected in the aging population. 70% of them tend to have drug duplication. Okay, and not only that, class, most of the aging population tend to have medicines that can interact with their disease or with the food that they eat. Okay, so these are the things. Dito ngayon papasok si pharmacist eh. Okay, as pharmacist class, since we have access to our patients' medicines, we can ask them about their medicines and check for duplication. Okay, or possible food interactions. Okay, of course, kasi you don't have to mention everything naman. Just the significant ones. Okay? So, in terms of gender naman, sino ang mas mareklamador? Babae ba o lalaki? Okay, char lang. Alright, pero kasi most women tend to have more health problems as compared to the male counterpart. Okay? Simply because, class, the female tend to have more hormonal imbalances. Okay? Sila yung nagbubuntis. Okay, so hence class, they tend to have more health problems as compared to the male population. That's why, class, we actually have a separate topic on female health, okay, or women's health. Right? So tingnan nyo to, amongst male versus females, mas maraming naka-experience na female ng muscle, joint, or back pains, headaches, and so on and so forth. Okay? Oh, kahit ako, I can attest to this. My wife has a lot of health problems. Skin problems, mas marami siyang allergies kaya sa akin. Yeah. Okay, kawawa naman na magiging baby na, pero still, I love her. Okay. Anyway, so concerns if patients are pregnant. So according to a study, more than 80% of pregnant women use at least one medicine. And 6 out of the top 10 medications used were OTC preparations. Right? So what to remember when suggesting medications to pregnant women? Okay, 3 main active ingredients in OTC pain relief are acetaminophen, aspirin, and ibuprofen. All of this class have the potential to cross the breast milk. Hence, if a mother is lactating, okay, is breastfeeding, right? Iwasan na lang ng nanay gumamit ng mga gamot na to. Although some people would say, class, diba, ay, paracetamol, diba sir, safe yan for pregnant women. Safe for childbearing women, pero not for breastfeeding women. Okay, kasi baka mapasa kay baby. So other recommendations, if possible, non-pharmacologic therapy na lang. Okay, take medications immediately after nursing or before the infant's longest sleep. Like halimbawa, kung sakali nagpapadede ka, kailangan mo ng paracetamol, padede ka muna bago ka magparacetamol. Avoid recommending any medication that are extra strength, maximum strength, or long-acting. Okay, I think that makes sense naman. And avoid recommending combination products. Right? Like halimbawa, ibuprofen plus paracetamol or ano nga ba to? Tuceran, mga ganon. Okay, combination medicines class, avoid recommending those to pregnant women. Okay, counsel about potential side effects that could occur in the child. Right, another common din class na reklamo ng mga pregnant women would be heartburn. Oftentimes, class, if a patient experiencing heartburn, PPIs are not advisable. Okay, they can cross the placenta and may affect the baby. Okay, normally if a pregnant woman has heartburn, the safest OTC product for heartburn for them would be calcium-containing antacids. Okay, Tums. Okay, yun, TUMs, Tums. Now, prescription drug to OTC switch. So as I've mentioned a while ago, class, all drugs will start off as prescription drugs. Okay, then they are switched to OTC once their safety is proven. So done by the FDA to switch the status of a drug from Rx to OTC as deemed fit. Normally, this is applied by the manufacturer, okay, whose patents are about to expire and be introduced to the generic competition. Okay, so if halimbawa class, gumawa ng product, mawawala na yung patent ng drug product ko. If I wanted class to still increase my sales, right, I'll push for my product to become an OTC product. Actually, class, most drug manufacturing firms would want to have their product as an OTC. Why? Because if a drug product class is already an OTC, mas accessible siya sa patients. Hence, class, more patients can buy, will have more access to the drug, and hence sales will tend to go up. All right? But of course, they have to prove first the safety and efficacy of these medicines. Now, a switch is only done when the following questions can be answered affirmatively. Can the patient adequately self-diagnose the clinical abnormality? Say, for example, allergies. Can you identify if you're having an allergic reaction? Ang dali lang naman yan eh. Normally, pag nagluluha ka na, sinisipon ka bigla, and so on and so forth, that could be a sign of allergy or nagkakatika ka. Can the clinically abnormal condition be successfully self-treated? Okay, is the self-treatment product safe and effective for consumer use under conditions of actual use? Right? Oftentimes, because you need years and years of study before you can answer these questions. So a survey found out that consumers can save up to $750 million a year as a result of using OTC cough and cold medications that was once considered an Rx drug. Okay, physician visits for more common colds dropped by 110,000 visits a year between 1976 and 1989. And these are some examples, class, of Rx products that were switched to OTC. Halimbawa, cetirizine. Tandang-tanda ko pa to. Rx to nung bata ako. Okay, pero now, class, we have a lot of OTC preparation for cetirizine. They actually applied, class, for switch to OTC when their patent was about to expire. Kaya ngayon, ang dami na ring what do you call this? OTC na cetirizine. Okay? Or this stat. Ayan, di na? Pseudoephedrine. Pero pseudoephedrine is not available in the Philippine market because it can be a precursor for making shabu. In the US, they still have this. Okay? So self-medication and safe use of OTC. So informed, appropriate, and responsible use of OTC medications is crucial for an effective self-medication. So pharmacists can combat the misuse of OTC through the following measures. Okay, can ensure that patients are able to read and understand product labeling. Okay, help patients avoid drug interactions, warn about potential allergic reactions and side effects, and discuss appropriate drug storage and handling. Now, in terms of drug storage, class, it's very important because number one, okay, storing drugs in proper containers or proper areas prolongs their shelf life. Number two, it prevents it from being misused by children. Okay, so halimbawa, kasi analgesics, antacids, most products or most drug products, class, must be stored on a high shelf. Could be kitchen cabinet or basta mataas. Okay, yun yung importante para hindi maabot ng mga bata. Okay, samantala yung mga bathroom medicine cabinet, okay, pwede natin paglagyan yung mga alcohol wipes, dental floss, disinfectants, gauze, thermometer, yung mga bagay-bagay na hindi makakain ng bata. Okay, so more medicines means more possible interaction. So as much as possible, because we try to go away with polypharmacy, pero minsan hindi kasi maiwasan, lalo for elderly, na marami talagang gamot. Nanay ko, 7 ang gamot na iniinom niya araw-araw, plus 1 more, okay, which is multivitamins niya. So more medicines, class, could lead to more possible interactions. And these drug interactions could be drug-drug, drug-food, drug-disease, or drug-alcohol interactions. Okay, so here are some examples, class, of drug-drug, drug-food. Okay, like ito, iba, aspirin plus garlic, sabi ko sa inyo, increased risk for bleeding. Okay, drug-disease, and then drug-alcohol interactions. So I'm not going to read this one by one. I'll leave this to you, class, to understand. Okay. So what is the role of pharmacy in self-care? So in a survey done in 2007, okay, asking pharmacists what do you believe is your role in the healthcare field, 90% said that they have an active role in counseling patients in OTC medications, and 40% of these pharmacists daw recommend 6 to 10 OTC preparations in one day. Okay, personally class, when I, minsan kasi nagbabantay ako sa butika ng pinsan ko. Okay, siguro class, mga 10 beses ako nagre-recommend ng OTC products sa mga pasyente doon. More than 10, actually. Sa whole day na stay ko doon. Okay, a lot of people would usually ask for help with regards to their conditions, okay, or ailments. And most of these, out of the 10 class, siguro mga 6 to 7 are conditions related to their children. Okay, namamaga yung gilagid, nangingipin, ganyan. So, obviously, I'll recommend Silogel. Okay? Or may singaw. Kung baby yan, Silogel pa rin ang recommend ko. Okay, kung matanda-tanda, pwede ng doctor rin. Anyway, yeah. So, what else? Another survey was done, okay, wherein which of the following counseling topics are most important when discussing OTC-related products? Okay, and for a pharmacist class, they believe that selection of the right product is priority. Okay, pinakalas ang cost. Right? Normally class, based on my experience, whenever I recommend a medicine, kung ano yung ni-recommend ko, pinaniniwalaan talaga yun ng patient. Okay, that's how powerful a pharmacist voice is. Okay, so it's also a responsibility for us because most patients tend to trust us. We don't want, okay, for that trust to be gone. Right? So that's why we study. We try to give them appropriate advice. Okay? Normally class, last lang talaga yung cost. Right? But of course, as pharmacists, kung alam mo naman walang pera yung patient, huwag natin pagpilitan yung mahal. Okay? So, pharmacists must ensure that the patient gets the correct practical information and understands the context of the ailment being treated. Okay? So, hence class, isa sa mga trabaho din natin as a pharmacist to know the pathophysiology of certain diseases, especially minor ailments. Kasi yun yung mga conditions na may expose tayo eh. Not unless you plan to work in a hospital. Okay? Yeah. And the information class must be practical. Alangan naman sabihin pa natin dyan, ay ma'am, yung gamot niyo po ay enzyme inducer, so pwede mag-cost ng ganyan. I don't think that's practical. Okay? Just, ano ba? Just give them the right information at the pinaka-importanting information lang. Okay? So, pharmacists can help the patient in the following ways. They can assist in product selection, assess patient's risks, okay, counsel the patient about the use of medicines, okay, maintain an accurate patient drug profile, right, including prescription and OTC preparations, assess the potential for non-prescriptions, which could possibly mask more serious conditions, like halimbawa, pain. Okay, kung yan ay paulit-ulit na pain, hindi nawawala, baka mamaya may underlying more dangerous condition na pala sa patient. Okay, and prevent delays in seeking appropriate medical attention. So it's our job class to identify these red flags and be able to assess our patient requiring immediate medical attention. So what to do during an initial encounter with a patient seeking an assistance with an OTC preparation? So first, we need to assess our patient. Ano ba talaga kailangan niya? Ma'am, ano po bang nararamdaman niyo? Ba't po ba kayo nandito ngayon sa butika? Kung bibili na siya ng maintenance, hindi niyo na kailangan ng interview yun. Maintenance yun eh. Okay, pero kung dahil may nararamdaman ng pasyente, dati mayroon akong pasyente, may problema raw sa tenga. Okay, sabi namin, ano na po ba mga nagawa nyo? Nalagyan nyo na po ba ng baby oil? Kasi parang nabibingi daw siya. Okay, so obviously class, meron ng baby oil na raw siya, hindi naman ito natanggal. So I give us reminololytic medicine. Ano nga ba yung tawag na? Sodium docusate. Okay, I recommend, that's an OTC preparations, don't worry. Medyo mahal siya, pero it works. Pangtunaw ng earwax. Okay, but of course, I always told the nanay, ma'am, pag hindi pa rin po yun nawala after 3 days, I suggest you visit your local your doctor. Kasi baka may kailangan i-flush na yung tenga. Masyado nang malaki yung tutol eh. Okay? Next is to differentiate self-treatable conditions from those requiring primary care. Advise and counsel our patients on the proper use of medicines, such as pwedeng no drug. Okay, that's an option. You don't need medicines for that, for certain medicines. For certain conditions, or advise patient on the outcome of selected course of action, then ensure the patient that the desired therapeutic outcomes can be achieved if non-prescription medications are taken as directed on the label. And then reinforce the concept that the pharmacists and physicians are qualified to perform follow-up assessment of the treatment. Especially for OTC class, kaya naman natin i-assess yun, if it's working or not. Okay? Now, Here are some selected conditions that can be treated with OTC drug therapy. Obviously, class, napakadami nito. Okay, we'll not be discussing everything. Okay, we'll just select a few that are usually found in, or common, na nakikita natin sa setting natin. Alright? Okay, so this is the last slide, class, for our topic on the introduction to OTC preparations and self-care. Okay, so hope you learned something, class, and you are now hopefully motivated to learn more about OTC preparation, how it is very important for us pharmacists, okay, to understand how OTC preparation works, not only for us, class, but also for our patients, okay, who usually use these OTC products. All right, and so with that, class, thank you very much for listening, and I'll see you guys again next meeting. Bye, everyone.